Hi, everybody.
Hello, everybody. Hi, Brenda.
Hi, Kim. How are you?
I'm okay. I've been sick a little bit, but I'm okay.
Oh, okay. Glad you're okay.
Yeah, it's good to see you.
Good seeing you.
Yep, I miss everybody.
I'm telling you, we've had some good stuff going on too.
I'm sure.
Mm-hmm.
I know I missed it.
Teresa started the advanced class Monday.
Oh, okay.
Yeah, and she's going to do it tomorrow and Friday too.
Okay.
So I guess it will continue. Well, I'll find out when she comes on. I'll ask her if it, if it's going to be ongoing like the regular class.
Okay.
Yeah. But I'm glad you're here.
Yes, I'm glad to be here.
Hey, Miss Brenda.
Hi, Miss Ann. How are you?
Oh, well, at least I can talk again. I'm telling you.
Oh, what happened? You had a cold or something?
No, I had an allergy from the pot smoking man next door to me, and
wow.
And I'm allergic. I'm allergic to marijuana. Like I could care less, except that it's bothering my throat because I don't smoke marijuana anyhow. So I don't smoke cigarettes. I have asthma.
Oh, okay.
The same thing with me. I have asthma too, Miss Ann, and that odor is so unbearable.
Oh, girl, it's so it's just ridiculous.
It is.
Oh, wow.
It really is. And then he's nasty about it.
Wow.
I told my lawyer. Well, he got mad because my case manager came by and got sick. So she got back in her. She couldn't get in my house. She was so sick. It was so bad. It was it was somebody else doing it too, but it was coming, right by my door. And people look at you real weird when you open your door because they think you in there smoking pot and having a good time.
Oh, no.
So it's embarrassing. But anyhow, she had to she called for help, and the police came and they spoke to him. So he's got an attitude with me. So he's rolling his eyes and telling the neighbors that I'm the one that called the police on him. So I knocked on his door and I told him I didn't call the police on you. I said the case manager, I had nothing to do with that. She's doing her job and she can't do her job. And you made her sick.
I went down for the lunch too.
It's not my problem.
Yeah.
Yes, all right.
That's a shame you got to go through that.
Yeah, it is. It really is.
Oh, wow.
And you can't talk to people nice anymore. They it's a me thing.
That's true.
But I told him the other day, if that's what they saw in my lung is from the pot smoking that he's been doing coming in my house, I'm suing his butt.
Oh, wow.
So y'all better pray that I don't be on nationwide television.
Good evening, ladies.
Good evening.
Good evening.
Good evening. Good evening. Yeah, Miss Thelma Jarrett.
I
Miss
miss
Jarrett.
How y'all doing?
Doing
Good.
great.
Hi, everybody.
Good
Hi, Diane.
Good.
Hi there.
Blessed.
Hi,
Hi,
Diane.
Diane.
Hi, y'all. Hi, y'all.
Oh, see, you got the chills again, Diane.
Yeah, no heat in here.
Oh, okay.
No heat.
Oh, wow.
And when you get as old as I am, you feel the cold.
Yeah.
True.
I'm coming
Now, Miss
up
Diane,
on,
you just look like you just 21. I don't know why you talking like that.
I don't know why she is either.
I'm coming up on my 76th birthday.
You sure don't
We're
look
the
like it.
same age, sweetie, and I am not gonna be old. Okay.
Well,
my granddaughters like to hang out with grandma, so they come and get me.
Age isn't but a
Turn my TV
number,
down.
That's right.
and I'm blessed to live this long.
Thank
Yeah.
That's
you.
right.
Amen.
Right.
So
Amen.
I hope to live to be 100. My grandmother lived to be 100 years old.
okay.
Bless
And
her heart.
my dentist lived to be 99. So that was close enough to 100 for me.
Wow. That's a blessing right there.
That's right.
Mhm.
That's
And my
right.
great aunt, she died, she was 102 years old.
Shoot, my
Okay.
aunt was 115. Shoot.
Mm. Yeah.
Wow.
My
Mm,
mother's part of the family lives to that long. My mother is 90. She has a sister right now that's 98. And her brother just passed 2 months ago. He was 99.
Oh,
You see,
okay.
yeah.
okay.
Because
Okay.
you know what? We living better because God has blessed us better to have more
That's
stuff.
Yeah,
amen. That's right.
Right. Mm-hmm.
that's right. Yes. Miss Kim, I can't see your beautiful smile.
I know. I try to, it switches up. I don't know why it does that.
Oh,
Could you push your
okay.
camera on, baby?
Yeah.
You pushed
It
the
did it the
camera
other
on.
day when I was on. It just switched me off, switched my picture off.
Oh, wow. Okay.
But I'm still smiling, believe me.
I can hear it in your voice.
That's okay, but we just would like to see your smiling
Oh, I
face.
know. I took the flu shot and it made me real sick. I feel like I had the flu.
Oh,
wow.
okay.
Wow.
Good afternoon, everybody. I'm Miss Barbara.
Howdy,
How
howdy,
are
howdy.
you?
Hi,
Good
Portia.
afternoon.
Brenda. I'm Miss
Hi,
Brenda.
Portia.
Hi, Miss Brenda. How you doing?
I'm doing good. How are you?
I'm fine. I'm fine. Hi, Miss
Hi, Miss
Diane.
Portia.
Hi there.
Hi,
Hi there,
sweetie.
Portia. How you doing?
I'm doing fine, thank God. Yes, ma'am. How y'all doing? Miss Diane, how you feel? You still
Bless.
fine? Oh, your airplane. Oh, yeah, I see it. All right.
Yeah, I'm doing fine.
Yeah.
Yeah,
Yeah.
bless we got up this morning to see each other.
Oh,
Amen.
yes.
Amen.
Oh, yes. Oh, yes. I agree totally.
And those who are not in the advanced class, you need to get in it because it's wonderful.
It is.
Oh yes, it
Okay,
is
now
wonderful.
who teach that class, Miss Diane? I don't think I'm ready for that yet.
Yes, you
Uh,
are. Yes, you are.
yes, you are, Miss.
Because you learn stuff every day.
Oh, okay. Well, what
And
time to come
when
on?
you repeat these classes, you learn something that you forgot that you learned.
Oh, okay. Oh,
Okay.
okay.
Yeah,
Okay.
it's good. It's good.
Okay. So who
Good
teach?
morning, good morning, good
Miss
morning, good
James.
morning,
Okay,
good
who's
morning.
recording with that?
This is Durbin, Washington. Good morning, senior iPad scholars. It's so
Good
Good
wonderful to
morning.
hear
morning.
your
Good
voices
Good
this
afternoon.
morning.
morning and to
Oh
see you
yeah, it
this
is
morning.
afternoon, isn't it?
Yeah, it
How you,
is.
Miss Teresa?
How you
I'm
doing?
well, praise be to God. And I put in the chat to you all. We're so blessed to still be alive and even to be able to be on this class learning. We're 67 and I'm 80 years old. I am so blessed. I give praise to God every day
Hey,
for being
Yes.
blessed.
that's right.
Yes. Amen. Yep. Yep. Yeah. So I think I'm supposed to go to that dentist Thursday up there at Howard University. I'm gonna try to go.
I forgot to tell you, I went and I was there for 3.5 hours.
What was you doing all that time?
I'm telling you, 3.5 hours I was there.
Who's that?
This
Sound
Kim,
like Kim. Yeah.
Oh, Miss Kim, what was you doing all that time? Wait.
they was looking at my mouth, and then I had a student. You have a student, and then you have to wait until his teacher comes in there. So she's doing other people. So you just have to wait, and then you gotta move. I mean, it's like you gotta move like a jigsaw puzzle. You gotta move from one chair to another. You gotta go upstairs, go downstairs, go upstairs.
Oh,
I had to do all of that.
right. But everything was all right. Everything.
Yes, yes.
That's good. That's good.
Yes.
Yeah, I made an appointment for Thursday. I think 10 o'clock, something like that.
Well, they very professional, I'm telling you.
Okay, okay, yeah. That
They
sounds
always
pretty
have
good.
been.
Yeah,
Okay.
they're very good and
Mhm.
very
Yeah,
professional.
Okay.
Always been very professional.
But you know what? I go to the where I think they're a part of Howard University. I go to Unity on Benning Road. That young lady she looked to be about 17. And she was the doctor though. And she did my mouth and everything and got my teeth and everything for me. And then one day I went out to lunch for my sister's birthday, and I took my oh my God.
Okay, hello everyone.
Yeah.
Hi, Miss
Hello.
Teresa.
Yeah.
Hey,
We have our
Mr.
guest
Rita.
Hi.
on board right now. It's
Yeah.
DeYoung. Can you see him? Can you wave at him? He's there, Chris DeYoung. He's there. Okay.
Mhm.
As we approach the 1 o'clock hour, I'd like to welcome Mr. DeYoung to our, as you can see, wonderful young seniors who are open for learning.
Mhm.
That's us.
That's
Yes,
us.
we are.
Yeah, that's us.
That
As
is
I don't know if
definitely
you've been
us.
told, Mr. DeYoung, that they've got now, they're in a technology training. So they're
Okay.
learning, technology and learning how to use their devices to access the world.
Amen.
They tune in 5 days a week to learn how to do so. And of course, on Tuesdays, we have individuals like yourself that come on board to give information. So I'd like everybody to welcome Mr. DeYoung, and I'm going to actually give him the mic right now so he can become our co-host. I don't know if he has any slides in place. Would you be using any slides, Mr. DeYoung?
I don't think so.
Okay.
I have some if you'd like me to, or I can send them out.
No, it's your thing. You do it your way.
That's right.
Yeah.
You do it
It's
your
your
way. As
thing.
you can see, we've got some wonderful.
What you want to do?
Okay, so listen up, guys. I'm gonna hand the mic over to Mr. DeYoung. You're gonna turn your TVs off. You're gonna turn your fingers of your phone off. You should not be on the phone while you're here in class, okay?
Yeah.
And any distraction, I'm gonna ask you to mute yourself. In the event that I don't find you doing that and it becomes distractful for the class, I'm gonna have to exit you out of the room. Because our important thing is to keep focus here and hear Mr. DeYoung, because he's taken time out to give you some wealth of information about insurance. And you know that's very important when it comes to our health care. Okay, so I'm going to hand the mic over to Mr. DeYoung. Take it, and we're all going to be here listening.
Thank you. I will say I don't use Zoom very often. It did take me a few minutes to get onto Zoom, so I know how technology can be challenging at times, and we're all learning, I think.
Yep, we are.
So my name's Chris DeYoung. I work at the DC Department of Aging and Community Living. I've been here for about 4 years, and before that I was at the Health Insurance Counseling Project at the GW Legal Clinic. So I've been working with Medicare issues for a long time in DC. So our office here, the State Health Insurance Program, we provide free help for answers to questions or problems people are experiencing with their Medicare coverage and or their DC Medicaid coverage. If you have some kind of Medicaid coverage, getting bills you shouldn't receive, or trouble accessing prescriptions, our office can kind of help resolve those questions and issues. Alice had asked me to come today to talk about 2 different programs. One is the Qualified Medicare Beneficiary Program. So it's a partial Medicaid benefit that's available through the district. And the other is it's our Home and Community-Based Waiver Programs, EPD waiver. It's a program that provides assistance for people to continue remaining at home if they meet long-term care level of needs. So a certain level of needing some additional assistance. There are programs in DC that help provide personal care aides in the home, and other services to keep people who might otherwise end up in long-term care setting, a long-term care facility, when they could remain at home with some assistance. So we'll provide the contact information for the SHIP office. I would like that in just a little bit, but so there are a few different Medicaid programs. So some people can qualify for full Medicaid coverage, which in addition to Medicare, covers all of your Medicare expense, co-insurance and expenses, provides low-cost prescription drug coverage. It also provides additional benefits that Medicare doesn't cover, things like dental, vision, if you need eyeglasses, personal care aid, transportation to doctor's offices. Eligibility for Medicaid for an individual, income has to be below around $1,153 a month. You can't have more than around $4,000 in savings to qualify for that full Medicaid coverage. There is another program at DC, partial Medicaid benefits, called the Qualified Medicare Beneficiary. It's a fantastic program, and a lot of people aren't really aware of it. The income limit for the QMB program for an individual is over $3,418 a month. So your income can be way higher. And there is no limit on savings. So if your income, if you live in DC, you have Medicare or eligible for Medicare, your income is below $3,418 a month, you qualify for the QMB program, the Qualified Medicare Beneficiary. And what this program does, it's really easy to apply for, 2-page application, and our office assists with the applications. The QMB program pays for all of your Medicare premiums, so that $171 a month that might come out of your Social Security benefit for Medicare Part B, the district would pay that. It would stop coming out of your check. It pays for all Medicare cost sharing, so you can go to doctors, or use your Medicare. It makes sure you're not responsible for any of the out-of-pocket costs. And for somebody, and it also provides access to a free Medicare drug benefit with very low copays, no premium, no deductible. So the QMB program is a very good program. Again, a lot of people who are eligible for it but aren't aware of it. So again, I think Alice wanted to make sure we're out and letting people know about it. And if after this, if you would like some specific things, we have a 1-page description of the program. I'm happy to send that out. I can probably email it to all of you, or send it to you, some details with the application. Again, we can do over the phone, or we can email it a copy of the application. It's again a wonderful program. Again, it's for people who are overqualified for Medicaid, DC Medicaid, because maybe they have a little bit too much in savings, or a little, income's over $1,100. Again, for QMB, you could have $200,000 in the bank. It wouldn't matter as long as your income is below that $3,400 a month. Happy to answer any questions about any of this as we go. Or
can I, Alice? This is Teresa. You may introduce yourself now, Alice. Go ahead. I gave you co-host privilege. Alice, you can unmute yourself and introduce yourself. She's trying to unmute. And some tech difficulties, yeah. Seems that she is. Meanwhile, if you have any questions, I will begin. If you can raise your hands, I will do it sequentially as your hands are raised on the participant list. So we have Diane. Go ahead and unmute yourself, Diane, and ask a question. Diane Leach, you may unmute and ask a question.
Here I am. Can you hear me?
Yes.
Okay. I wondered, how does it affect when you retire from the federal government? I often hear you talking about Social Security, but I don't come under Social Security. I come under the federal government, sir.
So you probably have a federal retiree health plan
Yes.
benefit in Blue Cross, Aetna. So some federal retirees did pay into Medicare, and they, so some federal retirees before, I think it was before 1981, they weren't taking FICA taxes out. They didn't pay into Medicare Part A. And so when they become eligible for Medicare, they're not eligible for free Part A. So it can depend, and this is why our office exists, because all of your health insurances are all different from each other. So some federal retirees may have free Part A, but they might not have enrolled in Part B. There's an option. If you don't, as a federal retiree, if you didn't enroll in Part B, your federal health insurance still pays primary. So the QMB program, if someone was eligible for it and they're federal retiree and they didn't get Part B, they could apply for QMB, and the district would actually enroll them into Medicare Part B. Any late enrollment penalty would be waived, and DC would pay the $170 a month premium. So it could, even a federal retiree, it could help. If you have Part B, it'll pay the premiums. If you don't have Part B, it'll enroll you in Part B. And having full Medicare coverage in addition to your federal health benefit usually helps lower whatever you pay out of pocket.
My other question is, I want to have two questions. Is how come we have to pay co-payments when we in Medicaid, in Medicare? Can you hear me?
Yes, that can depend. If you have federal retiree benefits, it can depend on whether you have both Part A and Part B.
Oh, okay.
Like, so if I'm in a Blue Cross Blue Shield, FEHB, and I don't have Part B, then I'm going to have some out-of-pocket expenses with my insurance.
It's cold out there.
It can really depend on which federal plan you have, and whether you have both A and B, because all the federal plans are really different. I mean, you can call our office and I can look up the information that's like specific to your federal retiree benefit.
Okay, but if I gotta call my agency to find if I'm in Part B and in open enrollment, take it out. Can I do that?
Yeah, I mean, we can look up if you have Medicare Part B, and if you're eligible for something. So if you didn't enroll in Part B when you were first eligible, there's a late enrollment penalty for delaying enrollment. If you were eligible for this QMB program, that would waive all that, and DC can enroll you in Part B. But I do think, and I'll put my phone number in here soon in a minute, that would be helpful to kind of figure out which. Because again, all the federal plans work a lot different than Medicare from each other. So getting specifics, and we can kind of narrow it down and let you know. I don't want to give generalizations and not have it be true, but generally having full Medicare coverage and your federal retiree benefit reduces your costs a lot.
Okay. And would you put your name down too, please? And I thank you for your information.
Okay. All right, Alice Thompson, would you like to speak now? You need to unmute. You're muted. We're not hearing you. You are unmuted, but we're not hearing you.
Can you hear me now?
Sure.
Yes. Great. I had a little problem getting on, but folks, I want to introduce Chris DeYoung. So Chris has worked with the DC Department of Aging and Community Living for the past 4 years as the supervisor for the Medicaid enrollment team. And you know it as the EPD waiver and SHIP. Prior to that, he was the director of Health Insurance Counseling Project at George Washington from 2008 through 2018, providing advocacy counseling for DC residents with Medicare and Medicaid. Since 2006, Chris has been working to improve access to affordable health care services for people with Medicare in the District of Columbia, focusing on expanding eligibility for Medicaid Medicaid programs and simplifying enrollment for eligible residents. So I just want to say, Chris, we thank you so much for being on. And I'm sure you're going to have a lot of questions, and they're going to enjoy what you're saying, because many people do not know. Probably most of you didn't even know what SHIP meant. Okay, so carry on, Mr. Chris DeYoung.
Okay, are you taking questions now, Mr. DeYoung? Or?
Yes, yeah. Any questions? You
Okay,
also put them in the chat.
Our next questions come from Ann Dennis. Go ahead, Ann, unmute. Unmute your device and ask your question.
Hi, Chris. Glad to see you there. I am a benefit from the Medicaid waiver and the Medicare, but I am not sure whether I'm on Part D. And how can I find out?
You can call me.
Oh, okay.
I'm about to put my cell phone number in the chat. So there's a SHIP hotline number. Most calls should go, but so I'm able to look in the Medicare system, and we can talk on the phone.
Oh, okay. Thank you so much. That will benefit me a lot. I came out of DC public schools on disability. I was in an accident and had a back problem, and so I have AIDS, and I have the nicest. I swear they're the nicest people working in my house. They are a God-sent blessing. And when you can't do things that you're used to doing, and you if they don't make you feel like you're a non-personable person, so that's a good program, and people who benefit from it are blessed.
I will say that if you're in the EPD waiver, you should be paying $0 for prescription medication. You should not be paying anything. But yeah, if you want to know like which specific plan or coverage you have, I can look that up to make sure you know.
Okay.
Yeah.
Thank you, Ann. The next question is coming from Jennifer Blackman. Go ahead, Jennifer.
Yes, I too am a retired DCPS person. And I was told that I did not pay into Medicare, but I do receive Part A and Part B. They told me I cannot get Medicaid because my income was too high. Now you said that the QMB, the income is $3,400. Is that correct?
That's correct. $3,400.
Okay. And you can have unlimited savings, right?
Correct.
How do you go about applying for QMB, 1, and 2? Will it include prescription drugs?
So, and again, so I would call the SHIP office, which I did put the SHIP office number, the hotline in the chat.
Yes.
We can mail you an application. You can go down to the Department of Human Services. There are different ways we can assist with the application. You can mail it directly back to us. We can submit it. So once you get enrolled in the queue, so if you're eligible and you're enrolled in the QMB program, and it's starting November 1st, the district will start paying your Medicare premium on November 1st. If you're not enrolled in Part A or Part B, DC will enroll you in that part, whichever part you don't have, and pay the premium. And you would, if you don't currently have a prescription drug plan through Medicare, on November 1st, you would be eligible for a Medicare drug plan with $3, $9 copays for generic and brand name medications on November 1st. It doesn't matter if you should have enrolled 5 years ago and didn't enroll in Medicare Part D. There's no penalty. You just, once you're eligible for QMB, automatically qualify for prescription drug coverage through Medicare with what's called extra help, lower costs.
Thank you.
Okay, our next question has come from Brenda McManus. Go ahead, Brenda.
Yes. Hi, Mr. DeYoung. Mr. DeYoung, I do have parts A and B of Medicare, and I also have the QMB, and I have Kaiser, and my Kaiser is through, they take care of all of my prescription copays and all of that. But my concern is I get about 20 calls a day from these scammers asking if you have Medicare Part A and B, and they're trying to get your information.
Yes.
And one time I addressed them, I said, well, what makes your plan different from any of the others that call me? So I never get an answer and they hang up. So, I mean, why is this constantly going on? I mean, it can be frustrating.
So yeah, I would say this time of year is the worst. It's Medicare open enrollment and Medicare open enrollment.
Open enrollment
October
period,
15th,
yes.
December 7th. It's year round in DC. Aid brokers sit at the pharmacies, from United Healthcare and other companies. So brokers make, if they enroll you into a Medicare Advantage plan, they make over $400 for signing you up. And so there's an incentive. I think there are some fine brokers who are honest people and give good information, but there are some that are not. That don't tell you all the information you need to know to make an informed decision. They might not tell you that the hospital you can go into all your life isn't in network if you join this plan. First off, nobody should be calling you. Anybody calling you and asking you for that information, I wouldn't talk to them.
Constantly.
No.
So the ship office.
Yes.
So our
They
ship
call
office,
every day.
yeah. So, and the advertisements on TV, mailings you're getting in the mail. So the ship office, so we provide unbiased information. We're not selling you plans. We can help you enroll. We're here to give you information about whatever options you want to understand. If you want to understand Medicare Advantage versus traditional Medicare, we'll explain it to you. We'll help you understand so that you can make an informed decision about what you want to do. And we can help you move forward with it if you want to. But again, I get a salary. You don't get paid anymore if I talk to you, don't I? Again, we're just here to explain how this stuff all works. Help resolve problems. I would just say there's a monetary incentive for a lot of these people who are calling. And the advertisements on TV. I guess that makes the world go around. But I would just be cautious. A lot of these. Not just being enrolled in something that maybe you shouldn't be enrolled in, or but just being misinformed about. But some of them are actually fraudulent, and they're taking your ID numbers and billing Medicare for things on your coverage. And it's a big problem. So I encourage everybody not to talk to anybody calling you about Medicare.
Well, I never give them information. I never give them no personal information. So, okay. All right, great. Thank you so much.
Okay, we now have one from the chat, and this is from Teresa Durbin. And her message is, didn't know I shouldn't be paying for any medication. I have been paying for some meds. What should I do?
So if somebody just has Medicare and Medicare Part D or prescription drug plan, there are premiums that belong to Medicare Part D and there are copays. If somebody qualifies for QMB or for Medicaid, a Medicare drug plan is free to belong to. There's no deductible, but there are still some copays. So if I have Medicaid, I'm just look up the exact amount. So if I have full Medicaid and a prescription drug plan through Medicare, my generics should be no more than $1.35. My brand name medicine should be no more than $4. If I have partial Medicaid, so QMB, my copay, the most I could pay in copays for medications, $3.95 for generics, and I think $9.85 for brand name medications. Only people
it's been $20 for 2 of my medications. That's why I ask, and so I'll call you and give you specifics, and you can guide me from there. Thank you.
Sometimes it could just be it was covered by your Part D plan, and now it's not anymore. I mean, they can change what medications they cover, which can be frustrating. So yeah, call and we can kind of go over the specifics and take a look at what's going on and help you understand or see if there's an option to change.
Okay, thank you, Teresa. Our next question, Thelma Jarrett. Go ahead, Thelma.
Yes, good afternoon, Ms. Chris. This is Miss Jarrett. I'm also retired from DC Public School, and my biggest problem is dental. Now, under my Kaiser plan, I've been had domain, but I didn't realize or find out the domain only carry a certain amount until I went to go get partials and more teeth work and all. And I found I ended up coming out of my pocket over $3,000. I'm still coming out paying and all. So I'm looking for, because someone was telling me that Medicaid has a dental program. Now, I talked to somebody in shift office last year, and I got the runaround, and all, but because I do have I have full coverage, full Medicaid coverage Advantage. I don't know if that's full coverage now, but I know I'm the highest you can go with the Medicaid, but it doesn't take care of the dental work. I mean, it take care of me coming in the office, 30-day visit, once a year x-ray, and once a year cleaning, thorough clean, but that's it. So this is my biggest concern is still looking for a dental plan.
So with Medicare, the federal Medicare, Medicare does not cover dental, basically in any way, shape, or form. So there are some Medicare Advantage plans, and Kaiser among them, that will provide limited dental and preventive care, to cleanings, ears, sort of x-rays, a little bit above and beyond that. But that's just Medicare Advantage plans. Traditional Medicare, if I'm just in Medicare and I have a supplemental policy, there's no dental coverage. I mean, honestly, the only things in DC that do cover dental, the Medicare Advantage plans are offered very limited. But if I have full Medicaid, DC Medicaid coverage, Medicaid does cover pretty comprehensive dental benefits.
Yeah.
But and it's one of the biggest gaps. I mean, hearing and vision, there's some gaps in Medicare, but dental is very, it's more important than vision, but
So
you can have health issues. But go ahead.
Okay, from my understanding that Medicare dental, that is for those with no income, because I know several people that have that, went to the dentist everywhere and came back with full mouth of teeth, brand new teeth, and all, but they have never worked a day in their life.
So yeah, the income limit for the Medicaid that covers dental is like $1,153 a month is the limit, and can't have more than $4,000 in savings. So it is low income program that covers the dental. And beyond that, there's some private insurance, but I think what you have for Kaiser is probably about the equivalent to a private insurance. I mean, it covers preventive benefits and a little bit above and beyond that, you do end up paying out of pocket for anything else. And I understand how difficult that must be. Dental is not inexpensive. There is some talk on Medicare side, and it's been going on for years, about picking up dental or offering dental coverage through Medicare. I think it's moving in that right direction, but nothing moves quickly in the Medicare world. So while eventually might be a benefit, it isn't now, and not aware of any other programs.
Okay.
Thank
Back
you.
to point A.
Our next question is Carolyn Underwood. Go ahead, Carolyn.
Mr. DeYoung, does QMB cover any dental?
No, QMB supplements Medicare. So the QMB doesn't cover dental, vision, or something Medicaid only benefits. The only way you could get access to some dental coverage through QMB is if you then enroll into as a United Healthcare dual special needs plan. So Medicare Advantage plan for people with QMB. They do offer $1,500 a year in dental benefits. Cleanings, set of x-rays, a little bit above and beyond that. Some of the other Medicare Advantage plans similarly offer something. I mean, I'm not, not to say that $1,500 in dental is better than nothing. the only way to access any dental coverage through QMB.
All right, thank you so much.
Sure.
Our next question is coming from Ann Dennis.
Well, you just answered most of what I wanted to ask was about the dental. So I will call you and ask you the rest because I don't want to take it away from somebody else. But you're very, very good. And you are the first person that I have ever talked to that is talking sensible and not talking out the side of their mouth and trying to tell you something that's not true. And I'm also worried about some of these people that are calling. Are they legitimate insurances or are they scams?
That you're getting
It's
calls from.
spams.
Some
Yes.
are scams, some are legitimate companies marketing things, but some are scams. And so I like to go on the assumption that they're all scams.
Okay, because you see this Medicare Advantage thing.
Yeah.
They've been doing that on TV. They're mailing me stuff. Everybody is mailing me something. It's enough to drive you crazy. But because you don't know who to trust anymore.
Well, I would just go on the assumption that anybody calling you is not from a really legitimate source. Medicare is not going to call you. Social Security is not going to call you.
No, they're not.
Unsolicited. I mean, they'll call you back. We'll call you back. But we're not going to do an unsolicited call. And nobody who's honestly legitimately selling something. I mean, some may be legitimately selling, trying to push a Medicare Advantage plan, but there's things that brokers can and cannot do, and they sometimes kind of cross that line a little bit. They're not supposed to do unsolicited.
I know.
They're not supposed to show up at your door. They're not supposed to be calling you. But I understand it has to be really overwhelming this time of year.
Really, but thank you for taking the time to explain to us seniors who are trying just to live and get by and do need dental work and don't know where to go and can't afford it. So thank you very much. I appreciate you.
All right. I'm now looking at one from the message, and it's from Dolores Washington. Can he send me a hard copy of the form to review and apply? Also, is this a lifelong program? I'm interested in the full under 3,000 income and unlimited savings.
Yes, the QMB program been around since the 80s. The eligibility for QMB in DC is higher than anywhere else in the country. Income limits 3 times higher than Maryland or Virginia. Most states have a limit of around $10,000 or $14,000. The district did away with that back in 2006, specifically to get more people access to low-cost prescription drug coverage that you get by enrolling in it. So yeah, the QMB has been around for decades and will be around for the foreseeable future. It's a very good program. There's no risk. Some Medicaid programs have thing called the state recovery. The state can come in and recoup some costs from your house and things like that in certain situations. That does not apply to the QMB program. There's no risk for enrollment in QMB. It can just be a benefit.
She has one more question.
Yeah.
How does this affect your present insurance? I have Kaiser insurance that will change.
So if I'm enrolled in a Medicare Advantage plan or Kaiser and I enroll in QMB, what would happen would be DC would start paying my Medicare Part B premium, stop paying out of my Social Security or federal OPM benefit. Then then DC sends information up to Medicare. CMS says, Chris is now enrolled in the QMB program. And that's the same source where Kaiser pulls their information from. So once Kaiser knows you're in QMB, they'll reduce your copays to the maximum amount of $3 or $9 copays. And they will also have to start waiving all cost sharing. So if you normally pay $35 for a doctor's visit, and you go down to pay your bill, Kaiser waives all cost sharing for Medicare covered services. Hospital stay, spend a month in a skilled nursing facility, they cannot legally charge you any Medicare cost sharing. That's what Kaiser is. Kaiser is your Medicare provider. can't charge you any Medicare cost sharing if you're enrolled in the QMB program.
Thank you. All right, our next question is from Portia. Go ahead and unmute Portia. You need to unmute your mic. Portia, unmute. She's having difficulty.
Okay, it's okay. Thank you, Mr. DeYoung. I wanted to ask, okay, I have Medicare, okay, and I had Part A and Part B. Now I went to the dentist and I was able to get some dental work done, and I think my insurance covered it. But you were saying something about some insurances don't cover it. I don't understand.
So Medicare, if you have Medicare and health insurance, that's all you have. Medicare and then a Medigap policy or supplemental coverage. Medicare does not cover dental. If you get your Medicare through a Medicare Advantage plan, so a private company, Aetna, AARP, or United Healthcare, if they're your Medicare provider, so it's called the Medicare Advantage, or Kaiser. Some of those Medicare Advantage companies will provide some additional benefits, like dental, some dental coverage.
Okay, because I have United Healthcare,
Yes.
dual, and that's where it fell on. I mean, you know, that's why I got, you see, okay, because they never asked me anything about a payment or a co-payment. Okay, so that the insurance company that I have is providing that for me.
Yeah, so there's a plan in DC, it's a Medicare Advantage plan, and it changed this year. It's called United Healthcare Dual Complete. The only people who can enroll in United Healthcare either have QMB only coverage, full Medicaid, or the home EPD waiver, home community-based waiver. So United Healthcare, if I just have QMB, the partial Medicaid, United Healthcare provides, next year it's up to $1,500 in dental benefits. Provides, I believe, 24 round trip transportation. Most people with Medicare don't get that. Provides a little bit of vision coverage. And I think they also give a stipend for you to use at the pharmacy or grocery store for over-the-counter products, groceries. Actually have some information about it. I believe the stipend is about $93 a month for somebody with QMB. They just give you $93 a month. You can use for vitamins, over-the-counter products, groceries. If you have full Medicaid, they give you a stipend as well. It's a little bit more. I think it's $133 a month. There's some benefits to, and that's why a lot of these brokers are running around, because if they sign you up for QMB, they can get you to sign up for United Healthcare. And there's nothing wrong with it, but it does offer some additional coverage, and that's probably where you're getting that.
Oh, okay, yeah, because they send you a catalog, and I think mine is $80 or something like that a month. Yeah. That's right. Thank you so much, sir. I'm learning a lot. Thank you.
Sure.
Thank you, Portia. We have a next question from Betty Jones.
Good afternoon. I was listening to what the other ladies were saying. One thing, this is just the 18th of October, and already this morning, as a matter of fact, I've had 3 soliciting calls. They asked to speak to Betty. If you ask to speak to Betty, then I know you're either a friend or family. But if you call my house and you say you want to speak to Betty, then we don't have anything to talk about. But they would start off with saying, we understand that you have had back surgery or you've had knee surgery. So these folks have access to your medical records without your knowledge. And I let them know, I'm not interested in what you have to say, because how did you get my medical information?
Yeah, that's pretty frightening.
Yes, it is. Yes, it is.
And I can't explain why.
I got a call this morning, and this was so funny, like weird funny. I was told, well, you're eligible to receive refunds from your Medicare payments. And I said, well, will this refund afford me to get a new car? I mean, don't be telling me I'm going to get $2 back, but send me some viable information. that says I can get a refund from what I've paid into Medicare.
So what they're trying to do, it's a big, probably national company. They're trying to screen you for a program like QMB. And they're going to say, oh, we're going to help you apply for QMB. And if you apply for QMB and you're eligible, you'll get $171 back every month going forward, because you won't have to pay Part B premiums anymore. But then once you're in QMB, they'll try to get you enrolled in United Healthcare Dual Complete. And again, it's just, and once they sign you up, they make $400. You know, it's a lot of people in DC, they can sign up, and that's a lot of money. What they're talking about is signing you up for a program like QMB. And the money you would get back from Medicare is not having to pay your Part B premiums. People do call some of those, you know, you see the advertisements with various actors, you know, telling you about Medicare savings, and you
Your paycheck, go back in
yeah,
your,
free, you know, everything. Those programs exist in DC, and there are different ways to access them. I mean, our office can help, you know, Department of Human Services does those applications. I would just say we don't have any kind of underlying, we'll help you apply, we'll explain everything, make sure you get all the benefits you're supposed to once you're enrolled, that DC's paying your Part B premiums. And we can help you understand what your options are with Medicare Advantage, or just, you know, have a Medicare drug benefit, as long as you have everything, all your coverage in place.
So I am interested in Medicare Advantage. Last year when I called during open season, young man I was speaking with on the phone, I could hear the ice clinking in the glass, and he was just all over the place. And I told him, well, you know, once you're done with your lunch or whatever it is you're doing, give me a call back. He never called back. I guess he fell out from whatever it was he was drinking. But I am interested in Medicare Advantage Part C. I would really like to get some information on that, but I guess I can find that information online too.
I mean, I'll also put my email address in here. I'll put my email on my cell phone. Feel free to reach out to me. I mean, there's only a few Medicare Advantage plans in DC. You know, it's pretty easy to look at. You know, important things are provider network. If there's a doctor you've been seeing forever that you really like to see, you don't want to lose access to, or if you've been going to the same hospital or like this hospital, you want to make sure that covered, they're in network. You know, it can always change, but you know, any cost sharing associated with the plans. Most of them don't have any premium. Some have a really small premium, monthly premium. Yeah, reach out to me. I can provide you with some specifics about.
Okay, so I can get your email address or your phone number?
Yeah.
Thank you.
It'll be in the chat. The phone number is already up there. Scroll up, but my email is right there. It's just my first name dot last name at dc.gov. It is open season. We'll respond as quickly as possible. I'll get back really quickly.
Okay. Well,
if you'd like to get a pencil and paper ready, I can read off his phone number.
I got it. I'm ready.
Everybody's ready? Everybody's ready with their pencils? Okay, as you know, his name is Chris DeYoung, and his phone number is area code 202-727-8370.
Miss Teresa, what's Chris's last name again? Would you spell it?
D-E and the word Young.
DeYoung.
Yeah.
Like the old shoe store.
Right. His mobile number is 202-374-8435.
Yeah, the first number.
374-8435 is his cell, and the office number is 202-727-8370.
Correct.
Okay, thank you.
All right. He also wants to share that the QMB income limit is $3,418 monthly. That's I guess the max that you can have, Mr.
Correct.
Young?
Yes.
Is that what you're saying?
Yeah, there's people below that amount.
To qualify. Okay.
Would you give that amount again?
$3,418.
And
I think I made that.
so, and again, some people, you know, if you're actually working, your income can be higher than that if you have a part-time job or job. So, but they do count like Social Security, the gross amount from your Social Security benefit. But if you're working or have some earned income, only half of that counts towards the limit. So,
Jacqueline Delaney would like, her question is, what is SHIP? I guess she came on late. You're muted. How did you get muted, Mr.?
I think I was coughing and.
Yeah,
didn't want you to
what
hear that.
is SHIP? This is a request from Jacqueline Delaney.
So SHIP, it stands for the State Health Insurance Assistance Program. So it's a federal grant that used to come from Medicare, from CMS, down to 50 states plus the 4 district, Guam, Puerto Rico, Virgin Islands. It's funds to go to each state. The SHIP grant, and it's to provide, again, unbiased counseling and assistance for people in that jurisdiction to understand their Medicare options and rights. We help people understand when they're newly eligible for Medicare. I think because in DC our eligibility for Medicaid programs, the income limits are much higher than other places. Well over a third of all DC residents have some form of Medicaid coverage. A lot of the work we do is also with Medicaid. So again, we're just here to, we get a grant just to provide you with free help understanding your Medicare coverage. If you're having problems, if you're getting bills, you want to look at other options during open season. We have enrolled 4 people today in various Medicare Part D or Medicare Advantage plans.
Okay, we have another question in the gap in the chat, and that's from Brenda McManus. Our question is, what is Medigap and how does it work?
So 2 different ways when people first become eligible for Medicare. We sign up for Part A and Part B. You can go with the Medicare Advantage plan, which is kind of the privatized Medicare Part C. And some people also have Part A and Part B. And if they may not be eligible for retiree health insurance, like a federal health insurance. So I want to go out and purchase something to supplement, because Medicare A and B has a lot of out-of-pocket costs. Part B only covers 80%. 1 night in the hospital and a $1,900 deductible. So there are things called Medigap policies. There's standardized policies sold by different insurance companies that fill the gaps in Medicare. So I go out and buy a Medigap policy from United Healthcare or AARP. It's kind of called more traditional Medicare. I go to a Medicare provider, they bill Medicare, whatever's left over gets sent over to my Medigap policy, and then they pay whatever they're responsible for. That's traditional Medicare. So let's me go to see any Medicare provider in the country. As long as you're a Medicare provider, Medicare pays, and then the rest gets sent over to my Medigap policy, my supplemental policy. And that's kind of contrasted with privatized Medicare, the Medicare Advantage. If I'm enrolled in Kaiser or Aetna, there's a regional network of providers in DC, Virginia, Maryland, this area. And they provide my Medicare benefit, but there's costs for co-insurance and other co-pays related to it. I think Medigap is again, Medicare supplemental benefit is more than the traditional Medicare. I don't know if I hope that explained it a little bit. Let me know if it didn't.
Okay. Kim Johnson, go ahead. Ask your question.
Yes, good afternoon, Ms. DeYoung. Okay, I have everything. I have the QMB, I have the Medicare, Medicaid. There's a prescription that I have, and I have asthma, so I have to have this prescription. Before I got United Healthcare, my prescriptions used to be $3.95, or either I would pay $9 for a prescription. Now that I got the United Healthcare, I have one prescription that I need. I'm paying $14 for it. I called United Healthcare and they said that it's not covered. And I'm trying to figure out why that prescription is not covered. And if it's not covered, how come I'm not paying the $3.95 or either the $9? Why is it $14?
So it could be a few different things. It could just be that it's not on the formulary for United Healthcare, so they're charging you the full cost of the drug. It could be that it's not something that's covered by Medicare. So there's 25 different Medicare drug plans, and they all have different formularies, which is why people look this year to, they all have to cover medications in all these different classes, but they can cover medication A, not this one that you were prescribed. So again, it could be one of 2 things that I can think of. It's covered by Medicare, but it's not a United Healthcare's formulary, so they're not going to cover it. There are ways to get them to cover it in that situation. It involves appealing something with your doctor. Again, it could be a medication. It could be an over-the-counter medication. Most of those are not covered by Medicare, or it could just be a prescription that Medicare doesn't cover. One of those two things, and again, you can call, I can find out the name of the medication, and we can let you know exactly what it is or why it's not being covered.
Okay, or if I decide to, have my doctor refer me to another prescription that's similar to that, how would I know if that's covered too? So there's no way of telling that.
You call us. There's a way on Medicare.gov to look up formularies for all the different plans. I can put in the medications.
Oh, okay.
It'll show me, is this covered by United Healthcare or not? There are easy tools to use. Not super easy, but we do it all the time. So we can certainly help look. And if this specific medication isn't covered, but another similar medication is covered, we can figure that out and let you know.
So let me ask you another question. Which one of those would be my primary insurance? Medicare, Medicaid, or United Healthcare? Which one is my primary?
As of this year, United Healthcare is your insurance. So traditionally, United Healthcare only provided Medicare coverage. For people with Medicare and Medicaid, this year, United Healthcare provides their Medicare coverage and their DC Medicaid benefits.
Wow.
For QMB folks, United Healthcare is your Medicare coverage, and it provides a little bit of additional benefits, like a little bit of dental. There's not Medicaid dental, but if you have full Medicaid and Medicare, and I'm in United Healthcare, I have one card now, United Healthcare. I want a dentist, I use my United Healthcare provider. I want transportation, rides to doctor visits, United Healthcare. And the same thing for my Medicare Part A and Part B coverage. So those got Medicaid and Medicare got merged this year. So in United Healthcare, so if you're enrolled in United Healthcare and you have Medicare and full Medicaid, United Healthcare is the provider for both benefits this year. It started in February. And
okay.
for people with Medicare, any of these Medicare Advantage plans are optional. I mean, I think they work well for some people. But at some point it doesn't. You always have the option of disenrolling, various times throughout the year, or enrolling into it if you want to enroll into it. So if you have QM full or partial Medicaid, you can switch plans 4 times a year.
And also, I have asthma. I'm on a machine 4 times a day. My tubing is not covered at all. I have to pay out of my pocket. Is there a way that I can pay for that?
I'd be surprised if that wouldn't be covered under your Medicare. I mean,
yeah.
I mean, if it's a nebulizer, it's durable medical equipment covered by Medicare. And if you're putting a medication into that nebulizer, that medication is not covered by Medicare Part D, which is prescription covered. It's covered by Medicare Part B because Part B covers the nebulizer. So I'm kind of surprised that wouldn't be covered, and I can look into that and figure out.
Yeah, because I get 400 vials of the solution, and it covers that, but it doesn't cover my tubing.
That's crazy.
Yeah.
I can look up to see how or why that should be covered.
Okay, I'll give you a call later. Thank you so much.
Sure.
Well, that seems that was the last question. Unless you have any other questions, we'd like to say thank you to Mr. DeYoung for his informative conversation.
Yes.
Information that was shared with us. I'm sure we all are leaving here knowing a little bit more about our coverage.
Yes, a lot.
Well,
And it's a good feeling. It's a good feeling to know what what you're up against when it comes to Medicare.
Well, thank you for the questions. And nothing worse than coming to these and I go through a bunch of stuff and it's just crickets. So I mean, that's why I do this, because I like to interact with people. And again, that's why you can call us, is we can find out more about your particular situation and get more specific information.
I just want to say one thing too. Chris will be with the DC vets on the 27th.
Okay. All right. So again,
Teresa, I
that would
wanted
be
to
the
ask a
last
question.
hold on a minute. That would be the
Okay.
last Thursday of this month.
Yes, yes,
Yes. So thank you for sharing that. Again, it would be at 1 o'clock.
1
So,
o'clock, right.
Right. Thank you. Go
Chris,
ahead,
I'll
Denise.
send you the invite.
Yes, go ahead, Denise. I know you had
Okay. I wanted to say, you know, that is what the lady was saying. Sometimes things don't cover under insurance. They should have it where when your doctor writes your prescription, it should say what insurance company cover it. Because once you go and get the prescription, they say, oh, your prescription, I mean, your insurance don't pay for that. And then you got to try to contact your doctor. Sometimes they might do it for you, but that is kind of a headache. Because it should say beside each medication that they write for you, this insurance pay for it, this one don't, this one do. That way it'll be easier for everybody. But they don't do it that way. The doctor just writes your prescription and say, go get that. And you go get it and they say, oh, that don't pay for that. You know. So I think they need to work on something like that. And it'd be easy for everybody.
I would agree. In the doctor's defense, I'll say that there are so many, I mean, there's 25, 30 different Medicare plans that cover prescriptions. And then there's dozens of other insurance companies, and each of those have different formularies, and it's maddening. And it's set up like this. I mean, it's, you know, I don't know.
Yeah, and then
It's
you
too
got to
confusing.
contact your doctor.
Yeah.
They got to try to find the right one that cover under your insurance if you don't want to pay for it. You see, that's still more work. So that'd be easier.
Mr.
Thank you.
Do you have time for any more questions? We just saw some hands went up. I know your time.
One more question.
No, I'm fine. I'm fine. No, you're on now.
How is your time? You're
Oh, I'm fine.
available?
Yes, I'm available.
Okay, so we'll take the next question from Thelma. Jared?
Oh, I just need a cell phone number.
Oh, okay, I can read that off to you.
Okay.
So I'll go with Carol Lawson, who haven't had a chance, and I'll find that cell phone. The cell phone number for Chris is 202-374-8435. Okay.
Okay.
All right, Carolyn, go ahead, Carolyn.
Yes. My question is about a qualified Medicare beneficiary. Because in 2016, when I was diagnosed, they put me on that. And lately I've had trouble with some doctors trying to get appointments because they said that's Medicaid and they don't accept that. And I wonder, is qualified Medicare beneficiary Medicare? Because I don't have a Medicaid card.
The QMB program, the Qualified Medicare Beneficiaries, it's administered through state Medicaid offices. So some people have a Medigap policy, Part A and Part B, and then they enroll in QMB and they still have all those coverages. Some people have Part A and Part B and only QMB coverage. That's their secondary insurance.
Yeah.
And if you do, if that's just you have Part A and Part B and QMB, then you know, when you see providers, they do need to be providers that accept DC Medicaid. And that's all hospitals in DC and a lot of providers, but certainly not all providers. If you have QMB, Part A, Part B, and you're in a Medicare Advantage, you're in Kaiser, it doesn't matter. You're a Kaiser doctor, they have to accept you, they can't charge you a copay. And the same applies to other Medicare Advantage plans. People can still run into problems with this. We get people who are being billed for cost sharing who shouldn't. And we're able to kind of step in and assist in those situations and get that taken care of.
But I don't have a Medicaid card. So when they tell me I have Medicaid, I mean, how does that factor into QMB?
So again, hopefully you have a QMB ID card. So the program, it comes down to reimbursement. So a provider gets reimbursed by Medicare. Medicare pays 80%, you know, and then they want that 20%. Well, a lot of Medicaid providers don't get that 20%. They get reimbursed 80% of the Medicare rate of so when they get that Medicare payment, that's payment in full. So if they don't take DC Medicaid, then they can't bill you for cost sharing if they see you. They can refuse to accept you as a patient because your QMB is your secondary insurance, that they don't take DC Medicaid. That nobody can bill you for cost sharing. But QMB is, well, for payment reasons, at this time, DC Medicaid doesn't really reimburse that 20% that Part B doesn't cover in a lot of situations. They do pay deductibles. They don't always pay the 20% that Part B doesn't cover. So some providers want that 20%. And if they only take Medicare, then those are generally the providers that expect the cost, to get reimbursed by 20%.
Okay, thank you.
Yeah, I mean, it's just for billing purposes, if you only have Medicare and QMB, it is Medicaid of a sorts as far as the cost sharing for Medicare.
Well, it's been a wonderful program because when I was diagnosed, they said the medicine would be $10,000 a month, and then the injections would be $1,777 each, and I had to do 6 a month, and I could afford that. And they said DC has QMB, and they've taken care of all of that. But when I tried to get other doctors, like I was trying to get a neurologist, I was on the phone from like 12 until 4, not nonstop, being told we don't take Medicaid. And finally I got one, but I hadn't had that experience before. So I was wondering if something has changed, but I'm very satisfied with QMB. It's kept me alive since 2016. I'm grateful. So thank you.
GW days. Yeah, it's not, there are fighting in providers, since the DC doesn't have a list of Medicaid providers if Medicaid is a secondary insurance, but there are hospitals all have these provider referral networks. You can give them, if you prefer a male or female provider, what specialty they are and what insurance you have, and they can help sometimes those are good resources to help find providers who are accepting clients, certain specialty, and take your insurance. I agree. It can be a challenge at times.
Yeah, this only happened last week for the first time, so I was just curious. Thank you so much.
Okay.
Okay, so we have time for one more question, and that's coming from Mr. Angelo. Go ahead, Mr. Angelo.
Yes, Mr. DeYoung, I wanted to ask you, when I signed up for Medicare, it was quite a while ago. Long story short, the individual that I was talking to said something about something called QMB. Is that the same thing as?
Yeah, a lot of policy, QMB, SLMB, QI1. It's the QMB program. Some people, it's easier to say QMB than QMB. I'm not sure why. Yeah, it's just an acronym kind of. Yeah, it's the same thing, the Qualified Medicare Beneficiary Program.
All right, thank you. You've been very helpful.
Okay.
Very, very helpful in everything.
No,
appreciate you.
Sure, no, happy to anytime.
All right, so we're going to say thank you to Mr. DeYoung. Thank you to Alice Thompson for.
Thank you.
Thank you.
Therese, can I ask one question?
You just want to, this is such a wealth of information, and the time you all took in getting it done for these wonderful seniors. So everybody say thank you and wait.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Yes, sir.
Thank you. Thank you very much.
Thank you, Mr. DeYoung. Thank you, Alice.
Thank you.
Thank you. Thank you, Ms.
Thank you.
Thank you, Mr. DeYoung and Miss Alice.
Thank you.
Yeah, very nice.
Teresa.
Yes.
Ms. Washington, do you have a question?
Can I ask him one question before you close out? Just one question.
Go ahead.
Okay, my question is, Medicare, Medicaid, and Kaiser insurance, plus QMB, which one is my main insurance? And also, how does it affect my Kaiser benefits?
So if you're enrolled in Kaiser, and Kaiser's your Medicare coverage, then Kaiser's is your primary insurance. They provide your Medicare coverage. If you have QMB, then that's your kind of secondary. So then Kaiser, you go to a Kaiser doctor, and they don't charge you that cost sharing, the copay, because you have QMB. The QMB is a little different than full Medicaid. If you have Kaiser, you have Part A and Part B, and you have full Medicaid. Kaiser is your primary insurance. Medicaid makes it so that you're not responsible for that Kaiser cost sharing. But if you need to access Medicaid benefits like dental, vision, transportation, you pull out your Medicaid card and you go to a Medicaid provider. So that's your primary Medicaid, full Medicaid would be your primary insurance for Medicaid only covered services. And I know this can be kind of confusing, but and it can depend on, so for those situations, you would use Medicare Kaiser for your Medicare coverage. You're not responsible for out-of-pocket costs. If you have full Medicaid, you just pull out that DC Medicaid card, and you would use that for the things Kaiser doesn't cover. Dental, transportation, hearing aids, eyeglasses.
Okay, and also you mentioned by having that, sorry, Teresa. Also, you mentioned so that way, if you have this, you won't have to pay that $170.10 anymore. They would deduct that as well.
Correct. If you have partial Medicaid, the QMB only coverage, or full Medicaid, DC pays that $170 a month. So when that eligibility starts, it takes a month or two for it to stop coming out, but they'll reimburse you past, $170 a month. So you get the full Social Security benefit with no deductions from it for
That's right.
for the Medicare premium. That's a lot of money.
Okay, so I look forward to, okay, thank you.
Thank you very much. It's now
Thank
past
you.
2. It is now past 2. We're going to say goodbye to Ms. Thompson and Mr. DeYoung.
Thank you.
I'll be glad. God bless you. Take care.
Thank you so much.
Yes, thank you, Teresa.
Okay, I have an announcement. DACO, the Department of Aging and Community Living, have a new app. This new app is in the App Store. They would like you all to test it to see how it's working. Anybody interested in doing the testing for DACO? I will help you download the app and then you will test it. It's it's easy way access to us. And DACO.
To drive that energy.
Miss Teresa, it's too much noise in the
I
background.
know, I'm muting the person. Go ahead. I'm going to repeat myself again. DACO has asked me to seek some seniors who's willing to test an app. Their app is called DACL. It's in the App Store and begin using it.
What's the purpose for that? Use it for what?
Okay, to communicate. For example, you can access us, you can access them. If you have questions, concerns, you have complaints, anything where DACL is concerned, you can communicate through that app with them.
I'd like to do it.
I'll make the announcements today and I'll help you download that app if you need help with that and provide it back. I have to report back to tomorrow's meeting. So how many volunteers am I going to have to download the app and begin?
I'll try it.
You want to do it now?
Well, if you want to stay on, I will help you download it. If you
Okay,
want
I'll do it now.
stay on.
Okay.
I can help you download it.
Okay.
So the rest of you, goodbye. See you. Hopefully, don't forget now, tomorrow morning at 10:30, we have advanced tech training. Learn how to use your reminder apps.
Okay.
Very good app. It's an app that everybody should be using, the young and the old.
Yes.
Should be using that
tomorrow, 10:30.
There's some young people on here.
10:30.
Yes, there are, Mike.
Where?
Okay.
I'm looking at one. I'm looking at you.
Excuse me. Oh, thank you. Thank you.
Excuse me.
I appreciate that.
Excuse me, Teresa.
Yeah, we have lots of young folks on this. I don't know about you,
Okay.
Dolores, we're all young.
Young at heart.
Excuse me, Teresa.
Go ahead, Mr. Hawkins.
Would you
welcome back. We haven't seen you in a while.
Well, I've been doctor's appointments and stuff. Would you be putting the information about the app online, in your regular email?
I could do that. I can also put the link to it. Yeah. It's the app
Yes,
now, so you do that, or you can go to the App Store, or you could stay online and I will show you how to download the app now. It's up to
I'm
you.
getting ready to walk into the doctor's office right now.
Okay, Edward, you have a wonderful visit with the
So,
doctor. It was good
okay,
hearing
thank
from
you.
you. I
All
will
right.
put it on the invitation.
All right, thank you.
You're welcome. All
And
right,
Miss Teresa, and that's bottom 3
pardon me?
for tomorrow.
Yeah,
That'll be 3.
tomorrow morning we have reminder app, and tomorrow afternoon we have module 3.
Okay.
Okay?
Yes.
That block we have tomorrow.
Right.
Teresa, Teresa,
I'm listening.
I have set up my Siri, and I put some reminders on my Siri. So,
Oh, really? You go ahead, Brenda.
so I've already set up my Siri and the reminders. So
Maybe you could teach the class then, Brenda.
no. Well, I did set up my Siri, so, and then I went to Siri and I said, Siri, remind me of my doctor's appointment on the 1st. And
Yes.
it said, got it. So
Good for
I love
you.
it.
Good for you.
So Brenda, when you said that to Siri and that day came, would it made an announcement?
Well, the day hasn't
Yeah.
come yet.
Oh, okay.
When it comes, it will. Yeah.
Yeah. I set up 2 reminders for me for the 8th of November and the 1st.
Oh,
So,
okay.
All right.
Yeah.
Hey, could you put a
That's
reminder in
wonderful.
there for me too? My rent is due on November 1st.
You must pay
Okay, for those of you who want to learn how to download this DACL app, I'm showing it right now on the screen. Can you see? I am.
Yes.
I say broadcast.
Okay, so the first thing, I want you to see what it looks like, because I've already downloaded it and tested it, so you can see if it's something that you'd like to do. So I'm going to the app right now, so you can see that. Here it is here. Can you see at the bottom of my screen, you have these pedals?
Where? I don't see it.
Where?
Which one is it?
It says
right here.
DC
In the right left.
Where?
DACLAPP.
Lower left. Right.
Yeah, I see it.
That's what the app looks like. So I'm
Wait a
going to
minute.
go into it so you could see what
She
you're looking.
talking.
You're looking. Okay, so this is what I found when I'm in there. As soon as I downloaded the app, this is what I found. Here's all the access you have. You have access to us, WTA, events by DACL.
The events around the town.
Right. So you have, so it's a good app to use. Why not use it?
That is, oh, it's on. Okay.
Okay. So
Okay.
that's basically what.
Wilderness Tech.
Notice at the bottom, we have a whole, we have, if you want to submit a complaint,
Okay.
DACL, they have a hotline.
And
Okay, so all this is available with this app.
Okay.
Okay, so now I'm going to go to the App Store and show you how to download it.
Okay.
Ready?
Yes.
Okay.
Yes.
Now I'm going to tell those of you who won with me yesterday will find it easier to do because I basically assisted you in configuring your device to not look for passwords when using the App Store. Now, if you find that you have to use a password, go ahead and do it. But if you were in class with me yesterday, you will not need to use a password to access the App Store because we did that. We went into settings and set it up where you don't have to use a password to get into the App Store. So I'm in the App Store now. All I did, I don't know if you saw what I did. Did you see what I did to get in the App Store?
No.
You tap
Let's go back.
A.
No.
Let's go back. I looked at this A. See the A there? It's the bottom.
Where's the A?
I tapped on that. That immediately just took me into the App Store. Okay. And then the next thing I'm going to do is type in the word or the acronyms actually. DACL. And I'm going to hit search.
There you go.
And there it is. That's it. That's how simple it is. What do I do next?
Hit open.
Touch the open.
Tap on it.
That's it. You touch app open and it's downloaded onto your device.
Yeah.
Okay.
Okay.
Hey,
That was 2 steps.
Teresa,
Mhm.
I already have it on my iPad.
Well, good for you.
Yeah,
Wonderful.
it's been
Yes,
on,
I do too.
It's probably already up
Yeah.
doing it.
but
So that's once they want to make sure that you all know it's there.
Oh, okay.
right. I looked at it a lot, but I never really did anything
Here's
on it.
here's another app that Denise told me about that I wasn't even aware that existed. It was
Hulu,
about,
Hulu.
hold on, let me see if I can find it. Denise, that one you shared with me was called
Learning
Learning Easy. Okay, here's one that's called Easy Tablet Help. You select
Yeah.
that. It's in green and white on my screen.
Green and
See
white.
it? At the bottom right, you tap on that.
Oh,
And it
that,
opens
yeah.
up, and it will help you with your iPad
Yeah.
and your iPhone.
Okay.
Mhm.
So you
You
might want to
could-
download that while you're in the App Store.
Right.
Oh, you had to down, oh, well.
Yeah.
Some of you have it already on your iPad.
I have, what's the one, the DACL? I have that one, but I don't have to download that, no.
Okay.
Right. So if you have it,
Okay.
you don't need to download it. Okay.
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 And then the one, that you just started, Easy Tab. Oh, I saw that, when the lady was talking about safe homes on the DACL. You know, when you need some work done in your apartment or your house, and
Safe at home.
they supposed to help you find some place to stay until they finish.
What app was that you're talking about?
That's on DACL, DACL.
Oh, okay.
Events. Yeah. Remember, it was a lady on talking about that the other day, that she used the safe home,
It's safe
because
at
she had to
home.
leave her apartment, and they found a place for her to stay until they finished doing the work. And I just noticed that was on there. In person ward.
Okay, so that brings us to the end of today's meeting. I'm looking forward to seeing most of you tomorrow in that advanced class where we will begin looking at Keynote, the presentation app, where you can use like a PowerPoint app if you've ever used PowerPoint. Okay, 10:30 tomorrow.
Hey, Teresa.
Hold on, that's not tomorrow. That's Friday. But tomorrow's reminder.
Hey, Teresa.
Go
You
ahead.
know what? Last night, you know what I was looking at? I was looking at the karaoke we did for February.
Oh my God.
I was laughing my butt off.
You did what?
It's on our iPads. It's on that little part where you go to, and it show you all the different tapings that we did. And Teresa, you had that
Let me
wig
show
on.
you. Let me show you.
You looked cute.
I want to see this.
Okay, let me show it.
You want to see
I'll
this.
show it to you right now.
Is that Dancing with the Stars?
It's on our iPad.
Dancing with the Stars.
Yeah. The senior stars. The senior stars.
First, you want to go, once you've downloaded the app, you go to Wilderness Technology, you tap on that.
Okay.
And then
oh God,
you get these are all what we did in the past. Here's one. I did one on using patient portals, reversing diabetes. There's the one that Denise is talking about, is the karaoke one.
Yeah.
So if you ever want to go back to any events that you missed, it's all here. I'm looking for that one though.
Teresa, I'm only seeing you.
You're not seeing my screen?
No, you can see the top of your head.
Oh, that's interesting. Let me see that. Let me try. Let me go back and start sharing again. Let me go back and start sharing again. Share screen. This is ended unexpectedly, so I'm going to share it again.
While we waiting, I just want to say I enjoy everybody on this class. You are so loving and friendly. You're definitely my second family.
All right, like that. Thank you. Thank you.
Thank you so much. I really appreciate that.
Thank you.
I'll go back one so you could see what I'm talking about. How do I even get to that? Let me show you. So I select my app and then.
Yes, I seen a picture with your name, but you move so fast.
Okay, so once you download the app, you then select the Wilderness Technology Alliance. Okay, you select that. And then you will find in here past videos on sessions that we did.
I don't see that.
Okay. Warning signs of Alzheimer's. That's the one we did last year. Karaoke contest. Here it is. That one there.
Oh, that's you in the karaoke. Oh, look at
that
you.
was last year. That's the one Denise is talking about. It selected. I think Denise said it would play.
Okay.
All right.
Okay.
Yeah.
Okay.
Here it is.
Who's that?
I got three of them right
Oh,
here.
he's been giving away the African jury.
Right, giving away the African.
Something's wrong with my camera still. I don't know what.
We wanted to
Doesn't
go
work very
on
well.
to the to some of the singing. Let's see if we've got some of the singing going
Yeah, I
on.
want to hear
Trivia question. This
Wow.
time though, you've got to put your hands in the chat thing for me to know who said it. We can't go because everybody's going to be saying it at the same time. Okay?
That's
Gotta
right.
put your hands in the chat thing so I'll know who did it. Okay.
Whoa.
Let's see.
I'm trying to find the efficient transportation, safe and home. Mistreated and ignored.
Whoa, whoa.
That was
That was just like the song.
Yeah.
The song said, let's get it on. Let's get it on.
Hey, that's amazing.
Right. And I want to give a kudos out to our musical engineer, Isaiah. He's doing an excellent job. My goodness.
Hey, Isaiah.
Yeah.
Thank you.
I like that. I like that last song. The
So
last
that's what
song.
we're doing it again. I'll almost tell you the date. I have it scheduled, and so that you could start practicing. The top winner walked away with a printer, right, Denise? I think she walked away with a printer.
No, I got a Apple I got a notebook, laptop.
Okay, so
No, I didn't do it with this. It was another thing we did.
So this is scheduled for December 20th.
So, Teresa, do you choose the song or do we choose the song?
We give out a list, you select your song, and we get the backup music.
Oh, okay.
And then we arrange it.
It's always like
and you have to dress up, and you have to
Even though I sing out of tune, I can't carry a tune. I'm the only kid that ever put out the church choir.
It's just for fun. It's just for fun. And Teresa picked out the best dressed man and woman.
And they both got what? External keyboards. They got keyboards for.
Wow. Yeah, keyboards and
come dressed up as well. You're coming to your virtual holiday party. The only thing we don't serve are drinks, but you can walk with your drink.
Right.
That was really nice.
Okay, everybody, it's on.
So that's it in a nutshell. So use that app. I'm gonna let Dackle know in the meeting tomorrow morning that you'll begin using the app, okay?
Okay. Thank you.
And the learning one, Teresa just told you.
Yeah.
Because everything she teaches us is in that learning.
Go to the library.
The learning town one.
Yes.
All right. So I'm gonna say goodbye for now. See you tomorrow.
Goodbye, everybody.
Okay.
Goodbye.
Bye.
Be good. Stay safe.
Bye.
Have a nice day.
Goodbye, everyone.
Bye.
See you around like a donut.
That's right.
See you around like a donut.
Bye-bye.
Bye-bye.